My name is Mikkie Harvey, and my colleague Mallory Woods and I will be discussing the impact of metabolic syndrome on cognition in the adolescent brain. In this presentation, we will describe the syndrome's characteristics and discuss the main impact on adolescents and their functioning. In addition, we will highlight which professions this issue concerns, the main stakeholders, and describe the implications for health promotion and health education and planning. Finally, we will assess the challenges such programming would face, as unfortunately most people are unaware of the term metabolic syndrome, much less its consequences. An article in an online journal, medicinenet.com, with the lead line, "Obesity might lower teens' thinking," led us to a study that suggests that obesity-linked changes may be affecting young people's minds as well as their bodies. The lead author of the study, Dr. Antonio Convert, is a professor of psychiatry and medicine at the New York Langone School of Medicine. He and his team published their findings in the peer-reviewed Journal of Pediatrics in October of 2012. This study found that adolescents with metabolic syndrome showed significantly lower arithmetic, spelling, attention, and mental flexibility, and a trend for lower overall intelligence. In addition, MRIs showed that they had structural changes to their brains and smaller hippocampi than their healthy classmates. This effectively diminishes their capacity in terms of memory formation and storage. The findings indicate that the health issues associated with obesity are having far more of an immediate and damaging impact on a young person's brain than was formerly thought. In view of these alarming results, it is reasonable to believe that obesity-associated metabolic disease may lower the academic and professional potential of adolescents. Therefore, researchers proposed that brain function be introduced among the parameters that need to be evaluated when considering early treatment of childhood obesity. Metabolic syndrome constitutes a major challenge for public health professionals in the field of preventative medicine. According to the American Heart Association, 47 million Americans are affected by it. That's almost a staggering 1 out of 6 people. The rise of metabolic syndrome is directly related to an increased prevalence of obesity and a sedentary lifestyle, not just in the United States, but across the globe. It is considered to be a global epidemic by the World Health Organization, and it is estimated that approximately 10% of adolescents are affected, and the prevalence rises to 44.2% in the obese. In other countries, around 25% of adults in Europe and Latin America are estimated to have the condition, and rates are rising in developing East Asian countries. Within the US, Mexican Americans have the highest prevalence of metabolic syndrome. The syndrome tends to run in families, and the prevalence increases with age, with about 40% of people over 60 are affected. Metabolic syndrome is one of the few clinical syndromes that affect large portions of the population that are potentially reversible with established interventions.
So what are the implications of being obese for the adolescent body? By late adolescence, the number of fat cells are predetermined. Overeating in childhood creates more fat cells, and those already existing cells will enlarge and reduce in proportion to the amount of fat stored. It's important to note that fat cells can shrink, but their numbers cannot be reduced. No matter how lean you become, once baseline fat cells have been established, the potential to become obese has been predetermined. Weight is directly influenced by the amount of energy stored in terms of calories and the rate at which energy is burned. BMI is a measure of the relationship between weight and height. You are considered to be obese once you reach the 95th percentile for your age. This puts you at an increased risk for many of the chronic diseases that play a central role in metabolic syndrome. The components of the metabolic syndrome are associated with insulin resistance, disturbance of coagulation, and fibrinolysis. Researchers have also identified endothelial dysfunction and elevated markers of subclinical inflammation. Obesity and lack of exercise are key components of this dangerous condition, which puts you at risk of developing serious health problems. There are a number of factors or conditions that place people at risk. Being overweight or having a waist circumference of greater than 40 for men and 35 for women. Having elevated blood pressure, blood glucose or lipids. Sedentary lifestyle. Family history of type 2 diabetes, hypertension or cardiovascular disease. History of glucose intolerance or gestational diabetes. Sleep apnea. And polycystic ovarian syndrome. Frontal lobes still are developing in adolescence and are therefore a more vulnerable region to metabolic dysfunction. Studies show that individual metabolic syndrome factors are linked to volume losses in the hippocampus and frontal lobes. One of the main cognitive impairments is in executive functioning. In addition, reductions in attention and IQ reported in childhood obesity.
Executive functions help you manage life tasks of all types. For example, executive functions let you organize a trip, a research project, or a paper for school. Often when we think of problems with executive functioning, we think of disorganization. However, organization is only one of those important skills. The executive functions are a set of processes that all have to do with managing oneself and one's resources in order to achieve a goal. It's an umbrella term for the neurologically based skills involving mental control and self-regulation. Thinking about what life is like for someone who has weak executive functioning skills gives us a better idea of the way these skills enable you to perform activities of daily life. Inhibition is the ability to stop one's behavior at an appropriate time, which includes stopping thoughts and actions. If this ability is weakened, teenagers are unable to stop themselves from acting impulsively. Shift is the ability to move freely from one situation to another and to have flexible thinking so as to respond appropriately to each situation. Without this ability, a teenager is unable to generate possible solutions for even relatively easy problems. Emotional control is the ability to modify emotional responses by using rational thinking as it applies to feelings. Adolescents have the added burden of hormonal development, which alters their ability to control their emotions. Initiation is the ability to begin a task or activity and the ability to work independently to generate ideas and problem-solving strategies. Oftentimes, adolescents are simply unable to begin a task on their own. Working memory is the capacity to hold information in one's mind in order to complete a task. Deficits in this area ensure that adolescents are often unable to hold any significant amount of information before they can act on it. Planning and organization is the ability to manage current and future-oriented tasks. For example, young people might lack the ability to systematically think about what they need to do to organize an end-of-term paper and manage their time well. Organization of materials is the ability to impose order on work, physical space, and recreation time. Adolescents may have trouble organizing their lives so that important items are easily accessible. And finally, self-monitoring. This is the ability to monitor one's own performance and to be able to measure this against some standard of what's actually needed or expected. Teens may not understand why adults and peers get upset when they're unable to have a roadmap as to how to get from A to B.
Who are the stakeholders and how can they be involved? Adolescents can be given the opportunity to be better educated about wellness through health education classes that inform them about the harm that metabolic syndrome can have on the brain. Providing this information allows teens the opportunity to access information from multiple sources. The challenge is not only how to encourage them to do so, but also how to help them move to action. Many behavioral change studies have shown that simply providing the information is not enough to make change actionable. Parents are the first line of defense against metabolic syndrome as an obesity-driven syndrome. Through education, parents will become properly informed about the warning signs and risk factors associated with metabolic syndrome. Parents can be helped to understand that obesity has medical consequences that may have an immediate impact on their children's brains and not just long-term health consequences. Families need support to be more involved in their children's lives to be able to offer adequate and appropriate nutrition as well as combat inactivity. Programs such as Red Circle, a multidisciplinary approach to weight management which empowers overweight teens to control their weight, is an example of an effective program that already exists. Your doctor will recommend lifestyle changes or medicines to help reduce your blood pressure, LDL cholesterol, and blood sugar. The goal is to lose between 7% and 10% of your current body weight. You could do this with moderate intensity exercise such as walking 5 to 7 days per week. You can also lower your cholesterol and your blood pressure by weight loss, exercise, and medicines as needed. This approach has increased through the years with the backing of the CDC, or Center for Disease Control, as it obtains federal grants. The CDC has a public health mission that is based off of a faith-based approach to healthcare. This approach will do the following: empower congregations and organizations, link faith-based organizations with community resources, build relationships between groups at risk in the community, and achieve social justice in health, dignity, and self-worth. Teachers need to be educated about what metabolic syndrome is via workshops or pamphlets and brochures that explain prevalence, significance, and implications of the syndrome. This approach will offer concrete strategies and solutions that address the primary manifestations of metabolic syndrome across all domains: affective, cognitive, and psychomotor. This will help children with executive functioning problems such as irritating behavior, managing physical impulsiveness, and turning in their homework. School administrators need to support nutrition education as part of a comprehensive health education curriculum that is consistent with national health education standards. They should encourage schools to implement nutrition education that supports healthy eating behaviors as part of a coordinated school health program beginning in preschool and continuing through secondary education. And they should support schools to provide experiential-based nutrition education for students, families, and staff, utilizing developmentally appropriate, culturally sensitive social learning practices that encourage lifelong healthy eating choices. School nurses need to capture the attention of the appropriate audience to inform them about the dangers of metabolic syndrome as it relates to the brain and other body functions. They need to have meetings and seminars to talk about preventative strategies. They should advocate for the children on their behalf. Adolescents do not know what is best for their body, and somebody needs to help them. They should intervene in health education classes, making sure that children are getting the information that they need. Given the dramatically increasing prevalence associated with premature mortality, disability complications, and the social and economic costs, management of metabolic syndrome is of great importance to public health. At the local level, you have the Boston Public Health Commission, who has programs such as Boston Moves for Health, which is an ambitious initiative to improve the health and wellness of the city by increasing access to free and low-cost physical activity and healthy living resources. At the state level, you have the Massachusetts Department of Public Health that has come up with a plan to encourage people at risk for metabolic syndrome to get involved by doing the following: talk to your doctor and know your numbers, your blood pressure, your HDL, and your weight. Keep active. Maintain a healthy weight. Eating healthy, and by use of medication as needed. On a federal level, there is the United States Public Health Service and Commissioned Corps. They have come up with Fit for Duty, Fit for Life. This movement contains the physical activity guidelines for Americans, which outlines the following important factors: aerobic activity, muscular strength, bone strengthening, intensity, frequency, and duration.
Mind-body modalities based on Eastern philosophies such as yoga, Tai Chi, and meditation may represent very useful adjuncts to the conventional care and management of the syndrome. These complementary therapies have many reported benefits for improving the symptoms and physiological measures associated with metabolic syndrome. In addition, these modalities have been shown to be very effective in reducing the psychological symptoms, such as depression, anxiety, and low self-esteem. Treatment for metabolic syndrome via these mind-body practices falls into the category of therapeutic life changes, or TLC. The National Institute of Health and the American College of Cardiology recommend therapeutic lifestyle changes as the standard of care for management of cardiovascular risk factors like elevated cholesterol and metabolic syndrome. Unfortunately, in actual practice, TLC is often discounted by physicians and insurance companies who instead turn to pharmaceutical agents, drugs. In fact, the 53rd scientific session of the ACC indicated that patients can achieve risk reduction of cardiovascular disease in only 3 months of initiating therapeutic lifestyle changes. Mind-body therapies have practical advantages as therapeutic interventions for cluster syndromes. They are simple, economical, non-invasive therapies that are easy to learn. Moreover, mind-body therapies have immediate positive benefits, including the feeling of improved well-being and increased relaxation. The challenges that we face encompass not only trying to correct the damage that has already been done, but also in getting the information to the correct people. As public health servants, the question arises as to how to focus our attention in terms of application of time, energy, funds, and the political will to make change. Given that problems with executive functioning are so pervasive in our society, should we look to interventions that seek to shift the entire bell curve to higher ground? Or should we focus our efforts on those disadvantaged sections of our population? For example, it's well documented that people of color, immigrant groups, and individuals with low socioeconomic status are already set up to be disproportionately affected and to have more serious health outcomes.
Having adolescents understand the underlying problems and make the effort of change in creating interventions whose efficacy is known and supported by all stakeholders involved will go a long way to correcting the impact of the syndrome. By using lifestyle changes that include diet, exercise, and stress reduction, metabolic problems resulting from unhealthy habits can be reversed. The old adage, "It's never too late," is certainly applicable to obesity and metabolic syndrome. For many teens and adults who have struggled with weight problems and blood sugar abnormalities, there are solutions.